First off, on vaccines, probably one of the biggest statements that you can say is, I think one of the single best public health interventions that we can make today, prevention-wise. I had some numbers in here from a conference that I went to about 6 years ago talking about the percentage of decrease of cases of the vaccine preventable diseases in Michigan, and it was in the 98 to 100% range, probably since 1962. I think that conference was in 2001. So the number of cases that we had was kind of unbelievable. You'd have 200,000 cases of something, and now you'll have 2 in the state per year. So the disease burden is dramatically lower. So this is really a situation where we've been so good at preventing these things that the general public thinks that they're really not a threat anymore. So we're kind of dealing with an audience sometimes, I think, of skeptical people who feel that this really isn't an issue, this isn't really a threat for my child. Is there a reason why I need to do all these vaccines? Is there a reason why I should go ahead and go forth with this? Or can I just safely, would I feel better about it if I didn't vaccinate my child at all, because there seems to be some controversy about it. So I try and bring up to people when I see them in the office that I think these diseases are still out there, they're still real. I should just say, I guess by way of background for myself, I did in my college at Kalamazoo College Medical School at Michigan State, and my residency at Butterworth or DeVos Children's Hospital just down the street here. At the Children's Hospital there, we saw regular cases of vaccine preventable diseases, some of which were due to issues where parents were against vaccines, some of which were due to poverty and just didn't go in, and maybe ignorance about what the situation was, whether they could be vaccinated or not. But I had a patient that I took care of that died of hepatitis B. We had a patient that died of chickenpox when I was there. We had measles cases. We had children almost die from pertussis. So I think the general public doesn't think that that exists. So I told a mom a couple of weeks ago, I said, I think it'd be nice to have you, if we could do this, go down to the Children's Hospital and just walk through the intensive care unit and say, okay, other than the car accident, trauma, kinds of bad things there, what kinds of things do we have here, and could they have been prevented? And you find that some of them could have been. And one of our newest vaccines, the Prevnar vaccine, is a meningitis prevention vaccine. And one of the biggest types of meningitis that I treated when I was a resident training there was strep meningitis. And with the Prevnar vaccine we have now, we're just not seeing that anymore, which is great. But I think the general public just doesn't get the importance of it. They just don't quite get it. So I'm here to say that they're important, and we all need to push for them to understand why they're important. And you're going to have a lot of discussions with people about why they think they're dangerous, or why they think that they shouldn't be forced to vaccinate, and why they think that I think there's really kind of a conspiracy theory atmosphere of those of us that have any sort of medical authority are trying to push people to do things with their kids that they're not comfortable with, and what's the reason behind that anyways. One of the things that was on your list of questions was the autism question, so I'll just kind of jump right to that. The MMR and questionable autism connection, or the allegation with that. There was a study that came out in 1998. Andrew Wakefield was a researcher in Britain, and he published a study in Lancet. Actually, it wasn't a study, it was a case. It wasn't a scientific study, it was a case report. So what he did was he had a clinic for children with gastrointestinal or stomach or intestinal issues, and these kids had some intestinal issues, and when they came in, he did a series of 12 reports of kids. They had developmental delays that were consistent with autistic spectrum disorder, and he went back and did a kind of a history with those parents, and they said, when about did you see these symptoms come about? And the answer was, I think it was about when the MMR vaccine was given. So his hypothesis at that point was that all of them had some hyperplasia, or which means kind of increased inflammation of some of the immune cells in the intestinal lining in a certain area, and his hypothesis was that the MMR vaccine caused that, and that decreased the child's ability to absorb some of the vital nutrients that you get when you eat, and that was the cause of autism. He didn't do any tests that looked at what were the levels of measles vaccine in the intestinal lining. He didn't biopsy anyone. It really was a very poorly set up study. And Lancet later came back and said, we are very sorry that we published this. It was a terrible idea. It was a terrible study. The science in it was bad. But it got some press. And then the anti-vaccine community really kind of glammed onto that, for lack of a better word. And they said, well, here is the proof that we've been looking for. Here's the smoking gun. So plenty of things have been done that have looked at his studies that have said, and I'd be happy to, I brought a kind of a bunch of papers here. If anybody wants to discuss afterwards the specifics of any of these things, I can pull out some references and say, here's why this has been proven as wrong. His hypothesis doesn't really hold up. He didn't biopsy anybody to see whether there was MMR vaccine or MMR virus at all in the intestine. He couldn't prove that there was an association between any intestinal issues and the autism onset. And then we have also the issue of autism tends to become more symptomatic during the time when kids are developing their speech, which is going to be between 1 and 2 years old. So I always tell everybody in the office, if you have something that's going to occur that's a significant development in a child, I can guarantee you that relatively around that time there will be a vaccination given, because, as Brady knows, pretty much every time you see me for a checkup in the first year and a half, there's going to be a set of vaccines at that visit. So if something happens 2 weeks after a vaccine, we can't say that that vaccine was the cause of that. We can say, well, they're temporally or time-wise associated. So I think that all we can prove, or all we can assume from Wakefield's study, is that around the time of the MMR vaccine, they think, by looking back, some of these kids were, it was 8 years prior when they were talking about when the onset of symptoms were, is about when those things happened. So the fact that it occurred at about the same time doesn't prove that they are linked. There was a study by an institute called the Institute of Medicine, which was made to look at public health concerns, and it's a board of physicians and scientists that are not on anybody's payroll for the vaccine community. And they looked at whether there was a true correlation with that or not, and they thought that it was soundly disproven that there was any correlation with that. So what we don't hear in the news, because it's not very exciting to say, is that the MMR vaccine is a safe vaccine. It's been used in the U.S. since 1971. So if that's the cause of autism, the recent whatever someone might call an increase in the autism rates certainly wouldn't be recent. It would be since 1971, and we'd expect that it would be steady, and we just don't see that. So I guess the one thing I wanted to bring up was the Wakefield study, which I really think was a poorly done study. I had to teach that to residents and medical students, and I had to point out the faults in it. I think it's just a terrible study. But the fact that it got put into a normal, well-respected journal kind of put us on the defensive a little bit. And we always say in pediatrics, it only takes one family crying on 60 Minutes to have a bunch of people not get a vaccine. But if you put a bunch of people on the news and say, my child didn't get polio because they were vaccinated, nobody wants to see that. It's exciting to see something that has an edge to it, that has a hint of controversy to it, but it's not exciting to see a medical success story unless it really has a big emotional content that focuses on one person's success in some way. But the success is so widespread with vaccines that it's almost boring to somebody, so nobody wants to see a story about that. So that really has been soundly disproven. The other issues I guess I wanted to touch on the autism front were a lot of people have said, don't we have more cases of autism now? Why is there a sudden increase in autism? I think there's a sudden increase in autism. I don't know if there's a sudden increase in the number of cases of autism. I think that there are different criteria that are used to diagnose that. One of the things that we use in medical journals is a thing called the DSM-4, which is a Diagnostic and Statistical Manual, or it has criterion for psychiatric diagnoses. In order to have the diagnosis of bipolar disorder, you have to have this criterion. So they'll say in order to have the criteria for autism, they'll have these criterion. Well, every time there's a new edition of that, the criterion get expanded. And I think that when I was training, the kids that we called autistic were kind of the worst of the worst, the nonverbal kids that would stand in the middle of the room and not be able to communicate and not be able to be calmed down. And probably Dustin Hoffman's character in Rain Man was one of the main people that brought up the face of autism to people that hadn't thought about it for a while. And he's on the extremely high-functioning end of it. So I think that instead of having just the bad kids, we realize that there's really what we call an autistic spectrum, or there's a spectrum of mild to severe, kind of like people with anything else. You can have mild hypertension or you can have severe hypertension, but we don't just call the people that have severe hypertension hypertensive. We call everybody hypertensive. So I think that we have more inclusion diagnostically. So these kids that we used to say, well, something's wrong with this child's social interactions, but we don't quite know what it is. Now we say, well, we really have some criterion to say we think it's autism. The other issue with that is to say that the schools will use it as a diagnostic criterion for educational planning. So you have to have a diagnosis sometimes for an individual plan to be given to somebody for a school program. So that's used in certain cases. So I think that we're calling more kids autistic, but I don't think the actual number of autistic kids is going up. So, and like I said, the MMR vaccine being used in the U.S. since 1971, I don't really think that we have a concern since 1971. It seems like we have a concern probably in the last 6 or 7 years. So that's my take on that. Also, we have some proof that autistic kids are different at the time of birth. There are some neurologic differences with them that some brain scans and studies have pointed out. Also, we know that certain genetic insults or things that happen to moms during pregnancy can be precursors of autism. So I always say if there's no vaccine going on at that point, there's no vaccine being given prior to birth, so we can't blame that on a vaccine. I think there's a combination of genetic issues and environmental issues. So there's some genetic links to say that this child might inherit the tendency to be autistic. Environmental primarily being prior to birth environmental, so in the mom's pregnancy, some sort of a toxic medication, some sort of a illness exposure. I don't think we really know, is the honest truth, and that's what I tell people. And if we as a medical community knew what the cause of autism was, it certainly wouldn't be a big secret. We would stand and shout it from the rooftops, and we would all run to take credit for it. You know, I think not myself, but physicians in general, scientists in general, they would like to get credit for some big discovery, and you know, that would be probably the big one to get on 60 Minutes right there. So we don't want to keep it secret. We don't want to have more autistic kids. We don't want to keep the cause of autism secret so that we can make more money from giving vaccines. You'll see this will be kind of a rambling discussion as I'm going on here. The other thing that I talk to parents about is, from a vaccine standpoint, I'm in private practice. I own the office where I work. All the things that go into running the office I have to purchase. Probably the most expensive thing is the vaccine supply, and every month we fret at what the vaccine bill is to buy all the vaccines. So I say if I was a really smart businessman and I didn't care about anybody, I would just stop giving vaccines in the office, and I'd say just go down to the health department and get them, and I wouldn't have to deal with that because our profit margin on them is extremely small. So pediatricians are not in the business of giving vaccines to make money. That's probably the thing that we make the least amount of money on. With that much overhead and that much money up front, we really don't need to do that. Those vaccines are extensively researched, produced in super sterile environments under unbelievable controls for sterility, just as significant as medications are. So you have supply lines that if there's any contamination in those supply lines, the entire lot is thrown out. There's a huge safety margin with that. I've worked in research settings before, in labs, before I went to school, and I know that there's no margin for error on those things. If you do badly, it's gone. You have to throw it out. You have to start all over again. There's a huge amount of oversight that happens with that. We have had some recalls of previous batches of vaccines. They will tell us ahead of time that there are issues with those, and there have been previous vaccines that were on the market, like the rotavirus vaccine, the first one in 1998 or 99 that was pulled off the market because of problems. Some people point to that as one of the examples why vaccines are bad. I point to that as an example of success of oversight. I think nobody was trying to hide the fact that there was an issue with that vaccine, and it was yanked off the market. It was gone, and it was quick that it was gone, and we got notice of it quickly too. So we get notice of any kind of issue like that, and we will not continue to give something that there's a legitimate concern about. But in the medical community, we are held to a higher standard, I think, of proof. So we can't just say, well, we think this or we think that. We have to say, well, it's been proven to work in this way, or it's been disproven to work in this way. It has to be reproducible in multiple studies by different people who don't have a bias or an interest in pursuing a certain agenda. They're just looking for an answer, whether it's the way they thought it was or not. Wakefield, the guy that wrote that article, has kind of gotten himself an extensive speaking career out of this from the anti-vaccine community, so I'm sure he's not turning any extensive speaking opportunities down after his fame that he's gotten from this. So that's my long-winded answer to the autism and vaccine situation. Thimerosal, or the mercury that was a preservative in vaccines until about 2000 or 2001, is another question that I get asked about. I think there's a lot of misinformation out there about that too. That has been used for years, probably was 50 years or more of use of that in medical settings. And it's in a lot of things that you wouldn't think it would be in. It's still in contact lens solution. If you don't use the sensitive eyes, then you're using the thimerosal containing contact lens solution. So I've talked to some parents about that. They have no idea. What happened with that is, about that time, the EPA and the FDA was doing a routine look at what are sources of mercury in foods and drugs. Can we get the sources of mercury out? Would that be a good idea or not? So we went ahead and said, yes, let's go ahead and do that. Certain vaccines were pulled off the market for a short amount of time until they could be reformulated in a mercury-free way, and now they're back on the market. So the only vaccine that has thimerosal in it right now is the multi-dose vial of the adult or 3 years old and older influenza vaccine. So I have a lot of people that come to the office and they say, we don't want any thimerosal. And I say, well, you know what, I got good news for you. It's not in anything except for the multi-dose flu that's for older than 3. And we're going to a lot more of those doses at in a preservative-free mode, but flu vaccine is sometimes hard to come by. So then it becomes a situation of, do we want to vaccinate these people even though we have that in that, or do we want to not vaccinate those people and not have the ability to get the preservative-free? So I do have some of that in my office, but it's a little hard to get. There never was any proof of any issue with thimerosal. This was part of a routine review to look at what can we do that would be better. So I thought, great, let's get it out. I think all of us were in favor of that. A lot of anti-vaccine families will say that it was done because there was a problem, but there wasn't a problem ever identified with it. This was a routine thing. I think it was a good idea to take it out. And I always say I was fine with that. Why shouldn't we do it? But the type of mercury that's in thimerosal is not the kind that's, in general, an environmental poison. There's one type, methyl mercury, which is usually the kind that can accumulate in your body and cause problems. Ethyl mercury, which is a chemically distinct one, is the type that was in the thimerosal, and that would be eliminated from your body relatively quickly. Not defending mercury, I'd rather have it out of vaccines. But I don't think that that's a true problem. So I've had some parents literally come in and say, I don't want any because of that. And then I'll say, it's not in it. And they'll say, really? And I say, yes. And they say, okay, go ahead. So then we'll go ahead and do it. So I put some people's mind at ease with that. Another issue that gets brought up is, are we given too many vaccines now? How come we have so many vaccines now? How come you have to poke my child so many times now? Isn't their immune system really good? Why do we have to do all this? Wouldn't it be better to just naturally get the disease and be immune that way? Wouldn't that be better? So the answer to the last question is, it's always better to get natural immunity if it doesn't kill you first. If you get strep meningitis and you die from it, you'll kind of wish that you had artificial vaccine-related immunity. So if we're talking about a mild disease, that would be fine to go ahead and get it. If we're talking about something significant, I think we kind of lose if we say, let's go ahead and see if we get the disease. Infants have antibodies from moms for about the first 6 months. They have some protection then, but still relatively susceptible to a lot of things. Their immune system is really easy to prime, and they respond fantastically well to vaccines at that point. And I think that a lot of people think that the only foreign invaders that their baby is going to be exposed to would be an injection of something in a vaccine. The reality is that everywhere there is bacteria, there's yeast. There are viruses everywhere also. They live on surfaces, they live on our skin. We have kind of normal bacteria in our intestine too. Babies are colonized with that after birth. Your immune system is good so that all of these normal exposures to the thousands of bacteria that are present in everybody's room and everybody's work surface are going to be fought off by that immune system. So the number of particles that we introduce with an injection of a vaccine is going to be minuscule compared to the number of exposures that they're getting on a daily basis. Even if parents are very clean, they're washing their hands, they're using sanitizers, it doesn't matter. We did a little experiment, I bring this up sometimes, a little experiment when I was in high school, my senior year in a biology class, and we went around with wet swabs and we swabbed tables and lockers and everything, and then we just put them in a culture plate and we grew it out, and you wouldn't believe the number of bacteria grew out of all that. And we were all grossed out and we thought, we're touching this, what do we, but well, your immune system saves you from being infected with all that. So we shouldn't downplay how good the immune system is, and we shouldn't say that the only foreign invader they're ever going to get is a vaccine, because that's just not true. Another thing I wanted to bring up was this. A nice little article that I read a couple years ago, and I printed it off again, so I wanted to make sure I said this correctly. Paul Offit, who is a famous infectious disease physician, has written a lot of great things about vaccines, and I've got a number of them in here. If anybody's interested, we can talk about it afterwards. And his point was, let's not just look at the number of shots, which is definitively higher now than it ever has been, per visit in total, probably in the under 2-year situation. Let's look at the number of foreign particles that we're introducing into the child's body. First off, the reason why we can't have a vaccine that encompasses all of the things that we like to vaccinate against is we have to prove, again prove, not just say we think it's true, that when we put the vaccine to be shipped in the vial, we ship it to the doctor's office, stays in the fridge, it gets drawn up in the syringe and injected into the child. You must prove that the immunity to that vaccine is the same as if you gave all of those separately. So it's a pretty rigorous process, and that's why we don't have more combinations, is because it's really hard to get that to happen. There are a couple of combination ones, but there aren't a lot. There's one new one coming out right now. There's one combination vaccine right now, I'll give you an example, that's MMR and chickenpox put together. They call it MMRV. That's good in some ways because it's less pokes. In order to get the amount of immunity from chickenpox with that vaccine that you get from giving an MMR and a varicella or chickenpox vaccine separately, you need to put 4 times the amount of chickenpox in that vaccine. So right now there's a little bit of a shortage of varicella vaccine because the MMRV has been so popular that they don't make the MMRV for, I think they had a couple-month moratorium on MMRV, and so we're not going to make it anymore because we need to stockpile our chickenpox cultures so we can make enough of the regular ones. So you can imagine how that works for other things. You would think if you just put the same amount in the syringe and give it, that it would work out well, but it doesn't work that way. We have to prove it. So that's part of the reason why we have so many. The other reason is we have the opportunity to vaccinate against more things now that we had significant problems with. One of the big ones is a strep pneumoniae, which is the most common cause of blood infections, kidney infections, blood infections, meningitis, pneumonia, sorry about that, in kids under 2 years old. We had significant problems with resistance to antibiotic treatment of that type of meningitis. So we had kids where we could not treat them. We would lose those kids because they couldn't be treated once they had that. So that one vaccine, this will give you an idea of vaccine testing and trials. They had a 38,000 child trial in California in the Kaiser Permanente system where a lot of things are done because that's a huge HMO system. They can follow health records really well statewide. So they had 19,000 kids that they vaccinated with the Prevnar vaccine, which all the toddlers today have had because that's been out since 99 or 2000. And the other 19,000 they did not. And then they followed them over time and said, those types of strep infections, who gets them and who doesn't. And the number of strep infections was probably, I think it was the 97% decrease in the arm of the study that showed that they had the vaccines. So close to the end of that study, they decided that it was unethical not to vaccinate the other ones, the people that hadn't had it. So they went ahead and vaccinated them. But the number of people in that trial was 38,000 total. So compare that to the 12 kids that Dr. Wakefield saw in his clinic. And I sometimes say this in my office. I'll say, well, I've got a brand new vaccine or a brand new medication that I'm going to give your child. I know it works because I've tried it 12 times before. Would you like to be the 13th one to try this? Or would you think to me, you seem like a little crazy. Maybe you could try that a little bit more and prove to us that that works well. But that's the kind of mindset that we're going against. So that particular type of bacteria we had trouble with. Now we just don't see it hardly anymore. So we don't have to worry about trying to come up with a super antibiotic to treat this resistant bacteria. We just don't see the bacteria anymore. So this is the table that I think is great. And he looked at how many particles are in vaccines. And he looked at 1900, 1960, 1980, and 2000. So this is a 2002 paper. And the number of particles that were injected in 1900, where the only vaccine was smallpox, was 200. 1960, 3,200 particles. 1980, 3,041 particles. And today, where we give the most shots ever, the one big, huge difference between today and 1980 is we use something that's called the acellular pertussis vaccine. So diphtheria, tetanus, and acellular pertussis, or the little a, DT, little a, and P. That's where we have changed things. Before it was whole cell pertussis. Whole cell pertussis is just you ground up the pertussis organism and put the entire thing into the vaccine. Works very well, also causes big fevers. Fevers in kids sometimes cause seizures, so the diphtheria tetanus pertussis vaccine, the old one, got famous for the one that caused seizures. Nobody ever had any, I don't think, evidence that there was a seizure that was due to anything other than the fever that resulted from that. So the old vaccine with that had a huge number of proteins, about 3,000. So of the 3,041 particles being injected into kids in 1980, 3,000 of them were from the diphtheria tetanus pertussis. Now our total number of particles in 2000 in this study, about 125. So the number of particles dramatically down, less than 5%. And the number of particles in that pertussis vaccine is between 2 and 5. The funny thing is, the immunity from this pertussis vaccine is better than the other immunity. So when you look at what they've really done is they've said, we're going to look at these markers, and we're going to figure out which one of these markers, which one of these particles we could put in there that would cause immunity to all the other ones. So I think this is a huge vaccine success story. So I tell people this, and they say, well, I actually feel a little bit better about this. It is more pokes, but you're putting less in my child's body. And that's a big talking point, I think, to discuss. And I'd be happy, like I said, to pass this on to you guys. That just makes a lot of sense to a lot of people.
So why can't they spread vaccinations out? That's the population.
Okay.
Why do you have to give them all?
Okay. Good point. Boy, I have all kinds of fun discussions in my office, probably on a daily basis. The way vaccines work, typically, most of them are a 4-dose series. So you get, for example, like a 2, 4, 6-month, and then a 15-month booster. So what happens when you give those vaccines? At the 2-month one, you get a little bit of an antibody response that increases as their body sees it as a foreign invader. It makes some antibodies. Antibodies are remembered for later, so your body can make more antibodies if it sees the same invader. So you get a little bit of an increase, and then it drops off. And then you come back at 4 months, a little bit more of an increase, and then it drops off. 6 months, a little bit of an increase, and it drops off. And your 4th dose at 15 months, big increase that stays. So that's what we call, that's the medical term, booster dose. That keeps your antibody titer high. That's the protective dose. When vaccines are trialed and studied, they are done in a certain way. They're done with certain timing between them. A big thing that you don't want to do is go too early for vaccines, or you won't be able to get the kind of response that you want. If you spread them out and go a little too late, that's considered acceptable but less than ideal from a physician standpoint and from a recommendation of the company standpoint. It really works the best when you prime the immune system in the way that it was suggested that you do it. So whenever a medication or a vaccine is okayed by the FDA, it's okayed in the manner that it was trialed and studied. It's not okayed in the way that Mrs. Smith decided to make up today when she came to the office. And I get a lot of that. I get up, well, I want to do this at this age, and then I want to do this at this age, and then I want to do, and I say, what's your reasoning for doing that? And my answer is always, I just think it's too much to put into their body. So that's when I come back to this, and I come back to, I think you're focusing on the number of pokes and not on the amount of things that are actually going into your child's body. And I try and prove to them that there's been a lot of progress in the amount of stuff that we put in there. I think it's dangerous to say, okay, however you want to do it sounds okay to me. Then I think we're really abdicating our responsibility. And sometimes you find yourself in a relationship with a parent, and you have to remember that your job, really, my job is to protect the child. My job is never to make the parents happy. I would love it if they were happy, and I try and be nice most of the time, try and be nice. But there are times when you have to step up and say, this might not be a popular thing to discuss, but I'm going to have to discuss this with this parent so that I try and give them an idea of why this is a bad idea. In general, I think the more confrontational you are with people about it, the more they pull away because they think that you are part of the problem. You are one of the people that's trying to tell them that they're wrong. So I think a safer, a better way to do that is to say, I can understand there's a lot of things in the news. I can understand why you'd have some concerns. Let's talk specifically about what your concerns are and let me answer those questions for you. So this kind of goes to, let's have a relationship that's open and that you trust me and I'm going to trust you to ask intelligent questions and do something that sounds like a reasonable thing rather than just do something that sounds like a whim so that you feel better when you leave. I would love to not have to have 4 or 5 shots at once with my child, but I don't feel bad about it because I know in the long run that's the best thing for that child. And I know from seeing vaccines given all day long that, you know, crying for 2 to 3 minutes and then they're okay on the way out the door typically doesn't upset the child in the way that the parent thinks that they're upset. So I tell them, really, the reason why we space them in the way that we space them and we give so many at once is that they've been proven to work in this way. So if you choose to use them in another way, I can't guarantee that they're going to work in the way that they were designed. So you really want to follow it's like taking medication and saying, well, instead of taking 1 pill twice a day, I just feel like taking 2 pills at the same time because it's just easier for me today. So I don't see a lot of people doing a lot of finagling of their medication doses, but I do see a lot of people try and do some finagling of vaccine schedules. I do have some issues where people will come in and they'll say, do they have to get them all today? And no matter what I say, their answer is they just don't want them all today. So then my statement after that is, well, how about if we do these 2 or 3 today, and then I have you come back in 2 weeks and you do these 2 or 3. And I have a lot of takers on that. Then I say that way you will not interrupt the schedule of how things work. So if we do a 1 or 2 week separation, parents are pretty amenable to that. That's if you have trustworthy parents that are going to come back. That's the bad part. So in a poverty-stricken situation with no rides to the clinic or something like that, the general approach probably should be, let's do it all today because we don't know if you're going to be able to get back here on time to get the other ones. And I see when you go to the health department, you get every possible vaccine that you could get at that visit. That's a general practice there. And I have some people that'll go there because of insurance coverage reasons and then come back to me and I'll say, yep, they gave you everything on that visit and they gave it to you at the earliest possible age. And we have some ability to fudge when things are given. There's a window with some vaccines and the health department always gives it at the earliest part of the window. And I think that's why, because we don't know when we're going to see these people again. And I don't mean that in a bad way towards them. Many times it's a transportation issue. We don't know if they're going to be able to come in. So that's a long answer to that question, but I think that's the reality of it. So first I would talk about how many particles we have, the fact that kids really handle this relatively well. We don't tend to see as many fevers as we used to before, and the fact that we really need to use it like it's a medication in the way that it was designed, in the way that it was studied, and not in a way that a layperson makes up so that they feel better. I had a discussion with a parent one time who had an idea of a vaccine schedule that she had gotten from a website that a physician had started. I think there's got to be some money involved in this one too. But the physician was a surgeon. So he had some ideas about what the issues were with vaccines and that vaccines should be given in this sort of a way. So we had a long discussion about how physicians are trained and how we kind of all get a little rotation in everything in medical school, and after that you specialize and go on and only do the thing that you're going to do after that. So I say I had 3 years of training in pediatrics, so day and night for 3 years, all I did was take care of kids. So do you want me to operate on you today, or do you think I'd rather have the surgeon operate on me that did 5 years of surgery training? So I don't think the surgeon really has the opportunity to know in a way that we do about whether vaccines are safe or how they should be given. I just don't think there's any expertise in a non-pediatric trained person. So you'll get all kinds of questions. I've had them all probably just like you have. And I think you don't want to make anybody feel bad in a one-on-one personal interaction. So the trick is how to validate their feelings of feeling a little iffy about it and still make them feel like you're not the enemy, but still suggest that we do things in the correct way and not in an incorrect way that we've kind of decided upon for whatever reason. So that's I guess, like I said, the long answer to the short one. Yeah.
Why, I think it's like the tetanus shot and something else, you have to get it every 10 years.
Mm-hmm.
Why is that, and how come you don't have to do that for all the vaccines?
It's a good question. I don't think we have any proof that the other vaccines lapse after primary series, with maybe one exception. And I'll talk about that here in a second. So tetanus vaccine, we think that your immunity does wane on that. And I use that as an example sometimes. I do not sell some vaccines as if they're a lifelong immunity because they aren't. Some of them aren't. That one definitively is not. So every 10 years you need to have a booster on that just because the manufacturers have studied that and they've said, yep, the titers or the antibody levels continue to drop off and your response is poor after that. I don't think that's that bad of a trade-off versus getting a tetanus or having a problem with that.
Yeah, I was just
No, that's fine. That's a good question. I get asked questions like that a lot. The new tetanus vaccine has pertussis in it, and there is one of the other things that we vaccinate against that definitively does go away. Your immunity is lost after a while. So we think that immunity lasts for 7 or 8 years, which goes beyond the point where pertussis would kill you, probably. Pertussis is lethal to infants, not so lethal to older kids and adults. So we get you past the age where you'd be susceptible to that and into the age where it's a nuisance illness. But what we find now is the number of cases of pertussis in Michigan and the U.S. have continued to go up, and the number of cases in adults is really relatively high. So what they've said is, what's the biggest public health risk to infants from pertussis? It's adults with pertussis. So we want to get those adults to not have pertussis anymore. So we'll get the adult levels down, and we'll get the child levels down too by not allowing pertussis to exist kind of in the community. So the new Autism vaccine is one of the two. I forget the name of the brand name of the other one, but it's a TDAP, tetanus and pertussis vaccine. So all of my teenagers that come into my office now get that one. I say this is a pertussis one too. And that nagging, persistent cough that a lot of adults have in the middle of the winter that they say, I don't know what this is, but I just can't shake it. A lot of times that's pertussis. So that would get better if we swabbed your nose and swabbed your eye and sent it off for pertussis culture. But frequently we just kind of wait that out because we're not sure what it is. When I say we, I guess it wouldn't be me because I don't see adults. So that's a good question. The other issue is lately the chickenpox vaccine now has 2 vaccines instead of 1. I think what they did with that is they said we think we have lifelong immunity with 1. The vaccines initially was studied in Japan for 25 years and followed, and their protective antibody was really good with that. But I don't sell that as a 100% vaccine. It's not. 85% of the time, if you're exposed to chickenpox, you will not get chickenpox. 15% of the time you will, but it will be a mild, modified case, 15-20 pox, versus an average case of 300 pox. So I think that's a pretty good trade-off, 15%. So what the vaccine manufacturers did is they said we've kind of studied that in the U.S. We've used that vaccine in the U.S. since 1995. We know that the immunity could be a little bit better with that, and if we gave a booster at some point, we would up the immunity into the high 90s. We'd be much more happy with that. The other issue with chickenpox is almost that it's a vaccine success story to the point where it's hard to find a child with chickenpox to expose your kids to. So that's another one that I hear. Can I just expose my kids? Well, if they don't get any complications, that would probably be okay if they're relatively young. But good luck finding somebody with it now, because you're not going to find somebody with it probably. So the natural exposure is low, and if you think about what happens with vaccines or what happens with natural infection with chickenpox is the first time you get it, you have antibodies. All of us in here probably had natural chickenpox. I know I did. Every time you run into somebody that has it, which could be after they're broken out or the day before they break out, that's the big time of transmission, you get a little boost in your antibody level. So you're constantly kind of reminding yourself to stay immune to chickenpox. What if we don't ever run into anybody? What will your antibody levels do then? That's a realistic question we're having to ask ourselves right now. So that's, I think, where that booster came from. So with 2, we go up into the high 90%, so that you'll have a less than 5% chance of getting a case of chickenpox, and even then it's just going to be the 15 or 20 pox. Some people point to that as a chickenpox vaccine weakness. I think, well, that's kind of a strength that we know that. The manufacturers have always been honest with this is not a 100% vaccine, and I've always kind of sold it to parents that way too. I said, I can't guarantee that they won't get it. We still have breakthrough cases, and that's one of the other reasons why they wanted to get it. So I think honesty in situations like that is best. Just tell them, you know, this is not a perfect situation, but it's much better than the alternative. And that's the issue with probably every vaccine is, what are the alternatives? Do the diseases really exist or not? Like I said, I think they do. Just go down the street and check into the hospital and see how things are going there. Or are the risks kind of over-exaggerated of the vaccines? But everything's a risk-benefit analysis.
What about splitting the MMR?
Good point. I have a little article in here about that. The MMR vaccine was given in a split form until 1971 in the U.S., and we have now what's called the MMR2, which is the newer version. So we have a 36-year safety record with that one and an efficacy record with that. Number one, if you split it, you go up on the number of vaccine injections, which some people are already complaining about. Number two, we don't have a safety record or an effectiveness record with doing that anymore. So that's an old record. We don't know how that would work right now. That's one of the things that Wakefield proposed. I'm not sure why he thought that would work. He said, let's split them into 3. And I thought, well, if the virus going into the body is the problem, giving the virus in 3 separate installments still instills the virus to the body. MMR is a live vaccine, so we're giving a live organism into somebody. It's a weakened strain, so it doesn't usually set up shop and cause infection. There's been no proof that that works. It's hard to get in the U.S. I had one patient who found out from the manufacturer that it can be ordered in the U.S. and demanded that I order them in 3 components, and I didn't. So that patient left in an angry huff one day, and you have to be willing to put up with that to do the right thing. It's just not been proven. It has no track record. It increases number of vaccines that you're going to get from 2 at 1 and 5 years old to 6, 3 at 1, 3 at 5. I think that's a hard sell for most people, and there'd have to be a pretty good reason to say, you know, we used to give this all together, but now we're going to give it apart. And the reason why is because it just sounds like a better idea to a couple of people, but not because we have any scientific proof with that. So generally not felt to be a good idea. My understanding is it's hard to get, although evidently you can order it. I think the reason why it's still produced in individual components is there are some rare people that have hypersensitivities to individual components. So we still have some unusual kids that won't get the pertussis vaccine because of some unusual reaction that may or may not have been related to that, but parents don't feel good about giving it. So I think it'd be hard to get. You probably could get it, but that's really what it's designed for, people with hypersensitivity or allergy reactions to the components of the vaccine. So just not proven, I think. Another one of those things where it's guesswork. Let's hope it works. Let's give 4 extra vaccines to see if it works. Just doesn't make a whole lot of sense, I don't think.
You talked a little bit about the main thing is that they are a certain distance apart. Like if you're going to have a hepatitis B, then you need another one within a certain amount of time.
Yep.
Is it really necessary to start a Hep B shot at birth? I mean, like before you're out of the labor and delivery room, you may have a Hep B.
I get asked that a lot too. Well, my one patient that, and this was a patient that I took care of in residency, not a patient that was mine in my office. One patient that died from hepatitis B acquired it from mom. This was prior to the age where everybody was vaccinated with hepatitis B. So I use that case a lot. I use other cases for examples. If you have a mom who, things are getting a little bit better with medical records, but here's a scenario, and this is what happened in Detroit in a couple of years ago. I was going to say 2004. A mom had a baby on the weekend. Her records were not available because the OB office was not open on the weekends, and they were supposed to be faxed over in anticipation of the baby being born, but they weren't. So the baby was born, did not get the traditional anti-hepatitis vaccine that we give, which is different than the hepatitis B vaccine. It's an antibody shot that blocks the hepatitis virus from setting up. What's that?
That's what you get in the hospital, is that?
If the mom is positive, yes, that's what they get. They get the antibody shot plus the regular vaccine,
But
both.
if you
It
don't
must
have hepatitis, then they would just get the regular.
just get the regular shot, correct. So the moral of the story is nobody knows. This child got hepatitis B and died. So an over-the-weekend situation in the hospital happens more often than you would think. We have a lot of access to computerized records, which might someday really solve the problem of that. If the mom is hepatitis B negative, do we need to worry a lot about those kids? I don't know. I think that it's always a good idea to give it in the nursery because we don't know what the exposure is going to be. Hepatitis B and HIV were the 2 big things that we were all concerned about when I was training, which was in the early 90s. One of the infectious disease nurses had a big session with us as hospital workers as we had been oriented, and she talked about what happens if HIV and HIV-contaminated fluid is spilled on the table. What's the effectiveness of that? What happens if hepatitis B is spilled on the table? What's the effectiveness of that? HIV dies on a non-living surface within 20 seconds. Hepatitis B lives for months on a non-living surface. So much more dangerous, really, from a standpoint of are you going to pick something up, is hepatitis B. So we all used to say, I'd almost rather start an IV on somebody that's HIV positive than on somebody that's got hepatitis B, even though we were all vaccinated against hepatitis B as health workers. So you don't know what the exposures are, and about 25% of people with hepatitis B don't have any risk factors. We have no idea how they got it. So if we have no idea how they got it, that really is a big thing as to why universal immunization against Hep B got started. We don't have an idea where you got it, and it lives on surfaces forever. Would it be a good idea to vaccinate all babies? Probably would be. Now, if I have some people that come to me and they say, I don't want to get it in the hospital, can I just get it at your office? Sometimes I do that. I don't know why that makes them feel better. 3 days later, 4 or 5 days later in the office, you're more happy about that? Okay, I'll do it, if that makes you happy. There is, yeah. The pristine baby, we don't want to, I understand that mindset. I've had some discussions where, I've had discussions with a mom for 45 minutes or more in the hospital nursery room regarding vaccines in general, not just hepatitis B, but I just don't want to do this, and I want to kind of, have a big discussion about it right now. And I think that that's a tough time for them to discuss about how many times they're going to get poked and how many things they're going to have. So I think it's almost better to say, well, let's discuss one thing at a time and not discuss what's going to happen in the next year and a half or 2 years. And don't make a lot of decisions based on the fact that you feel this way at this moment. Yeah. Did you have somebody that did that to you?
No, me, but I mean, after you have a baby, it's not really the time to talk about anything.
That's a tough one, yeah. Yeah, you're more interested in, you don't understand why your child has to be taken away and have this done. And they do the newborn screening test, they do the vitamin K shot, and it's not a lot of times the bonding experience that some moms were looking for, I think. And they feel like we're taking them away to do other things, and we have to kind of tell them we think this is in their best interest. And I think you're seeing a lot of change in most hospital environments to try and put the baby with the mom more, try and decrease the number of medical interventions that we're doing, try to treat the birth as a normal thing rather than a disease. And that's what I've always kind of said. We have now kind of nice birthing rooms and that are bigger, they're not so sterile, we don't have everybody in an ER kind of setting delivering a baby with a lot of hubbub going around right on the other side of the curtain that's been pulled across. So I think the experience is a lot better for most moms, and that's a big thing that sells hospitals too, or sells people on going to a certain hospital, is what's the experience that I'm going to have there. So nice to not have that broken up. On the same token, you'd like to have them leave with everything that they need to succeed too. So when you don't know what other people's exposures are going to be that come around, I think there's more Hep B in the community than we know about. So that's my general answer to that, is just because you don't know where a lot of those people got it. I think a couple things I think we should think about looking at hepatitis B vaccination, the general population, not just the pediatric population. All the healthcare workers are vaccinated, but I think if you're trying to decrease spread, probably everybody needs to be vaccinated, not just the infants. But the most effective way to eradicate disease in a population is not to pick and choose who's at risk. It's to vaccinate everybody, and the really more effective than just doing the at-risk people at all is to vaccinate all of the infants, and the whole society kind of grows up disease-free. So that's been one of the great reasons that we vaccinate too. So like I said, again, a long answer to a short question.
One reason I asked that too is because in the course of his immunization schedule, my son ended up with an extra Hep B.
Okay, all right, good question.
At least an extra, maybe 2 extra Hep Bs, because then by the time he was getting his last of whatever else it was combined with the Hep B.
Yep, you're correct. Okay, I'm going to give you a long answer to that. I'm going to write something out on this. Here's what happened. In 99 or 2000 or 2001, when the thimerosal was taken out of all the vaccines, hepatitis B was one of the ones that had thimerosal in it. So that was given at birth. And the question was, if you give that vaccine at birth, at 2 months, and then at 9 months, which is our standard schedule, do those people, or if we use that with the other vaccines, if we add up all the little bits of mercury in all of those, does that amount come up to too high per body weight for an infant? And they thought that theoretically it might. So what happened then is we had no preservative-free Hep B on the market at that point. I was practicing in Grand Rapids then. I started working here in 1998. So what happened was you had initially Hep B that was given at birth in 1 to 2 months and 9 months. Those were the standard ones. After the thimerosal scare, we only had one vaccine on the market immediately at the time that all of that was pulled off the market that had a preservative-free Hep B in it. That was a vaccine called Comvax, and I still use that in my office. So Convax was around and had not been very popular until this problem, and then went through the roof. It was really popular. So Convax is hepatitis B plus Hib, which is a type of meningitis prevention vaccine, combined in the same shot, and it's preservative-free, and it always has been. It never had to be pulled off the market because it never had that in it. So when this problem came up, we can't give this dose. The actual recommendation was, don't give that dose either. Give dose number 1. If it has to have thimerosal in it, give it at 6 months old. So we weren't doing anything to anybody prior to 6 months, or give this at 2 months, which is the earliest you can give it. So we really started going to this because this seemed like a good idea to us, and everybody likes combination vaccines at work, right? So we started doing that. So what happens is then we have a 3-dose series, and Convax is given at 2 months, 4 months, 15 months. The spacing of that is perfect for this and for this. So we're all happy tooling along there, and then they come back 6 months, 9 months, a year later with a preservative-free Hep B, and they say we're going to reinstitute the nursery dose. Now, everybody is using a 3-dose series that they love, and the parents love it too, and it's preservative-free, and now we have that. So now we say, do we go back to splitting everything else up or not? Well, kind of depends. So here's what we did in the community. The American Academy of Pediatrics said it's fine to give an extra one in the interest of not poking as many times and simplifying the vaccine schedule. It's always fine to give an extra if you have to. Hib has 2 ways of being given. Like I said, this is a long discussion. You can give Hib in, so maybe if I draw this out, it'll make a little bit more sense. Act Hib is one brand, and that's a 4-dose Hib. And the other brand is PedVax Hib. And that is a 3-dose series. So in the scientific proof category, this company went to the market and they said, at 2, 4, and 15 months with PedVax Hib, we have the same antibody levels as you do with a 4-dose. And they got okayed for that, and PedVax is the kind that's in Convax. So now, here's what happens. Either you get 4 doses of Hep B with a birth dose plus 3 of these, or we skip the birth dose, we do 3 of these, you're going to miss a time there. Or if you split it and do it so that you only get 3 Hep Bs, you're going to have to give 4 Hibs. So it ends up being 4 of one or 4 of the other. Health departments sometimes can find this separately. There's never been a problem with giving 1 extra one. So I bring this up with a lot of new parents, and I say, you're going to look at your immunization card, and you're going to see that Hep B from the hospital, and then you're going to see 3 more from me. I'm telling you now, I want you to know I'm doing that. I know I'm doing that. I want you to know why, and we have this discussion kind of quickly. So the answer to that is to increase the convenience factor, but also to decrease your need to use the 4th dose of that one. That's a confusing one to give sometimes. It's one of the few vaccines that we use that has to be made from powder and diluted with water and then given. So that's a little more error-prone than giving something that just is already in a liquid form. So like I said, a long answer to a short question.
Skipped the birth one.
Mm-hmm.
And said, I'm just going to go with this Convax combination. You'd still end up with hepatitis B immunity at 15 months, but you would have ended up with a 2-month window
of no protection. Correct. That's the reason why that's frowned upon. Now, do I have some parents that refuse a birth dose and I can't talk them into doing it? I do. And then they get 3 doses here, and I say, I can guarantee the immunity will be good. I can't guarantee you what your baby's exposure is going to be in that window of not being protected. So some people will say, what if I never leave the house? What if I, you hear all kinds of scenarios. Well, theoretically, that's a good thing. I just, no matter what scenario you present to me, I'm not going to say, yeah, that sounds great. I'm just going to say, well, I can't tell you, because I can't. I don't really know. So it did kind of throw us for a little bit of a loop in that we thought this was really a godsend, and that gave us the ability to have a preservative-free one that we could give at 2 months instead of waiting for 6 months, which we thought was just unacceptable, really. So now they're back at the birth dose, and I think the reason why that's given is to prevent vaccine error, prevent errors in missing cases of parents that have hepatitis B, moms that have hepatitis B that we don't know about it, and exposures to people that we don't know about in the first 2 months. So that's how that works. So you end up getting kind of 1 dose extra of something or 1 dose extra of something else. I'll give you another example of extra vaccine doses. I see a lot of international adopted kids, so they'll come in some will come in relatively young, but usually not younger than about 9 months old by the time they go through all the paperwork and the home study and all the things that have to be done for adoption. When they come into the U.S., the general recommendation now in the U.S. is to ignore all vaccines that were given in another country and revaccinate from the beginning as if they're 2 months old today. So I have that discussion with people. I've had a couple of kids that have come. I had one child from Guatemala who came with a full vaccine record. Everything was done. I checked the hepatitis immunity, and the child was not immune. I said, so I can't tell you what that means. Does that mean that the vaccine was substandard, or does it mean that the vaccine wasn't given in the first place? I have no idea. So I have a couple cases like that, and I think, yep, I'm a believer now, revaccinating all those kids. So might I be giving double doses of everything? I might, but I don't know what happened with that child otherwise. And I think the safe way now is to just revaccinate all those kids.
You're not concerned about the extra vaccination because, like you said earlier, like the immunity level is here and it's fine. So even if they're getting more,
correct.
the body's just saying,
Not going to have a problem. The only incidence that I know of if you have an extra vaccine a little too soon is if you vaccinate too soon with the tetanus, the adult tetanus vaccine, you're going to have a big local reaction, a big red sore arm that's just too soon. So traditionally the only reason we do those early is because of injury. If you have an injury with an open wound and there's dirt in it and we think it's been more than 5 years, you get another one, even though you're not due yet. So yeah, there's never an issue with whether they can have an extra one or not. Most parents would like to not have an extra one, but from a safety standpoint, it's always been safe to give an extra one. In general, if we don't know, we give an extra one. And the health department for sure gives an extra one if they don't know. If you have a child that they can't prove anything, we have some people that come in from out of state. Pediatricians, the other office won't send us records. They're 2 months old. Did they have them? Did they not? Sometimes the parents will say, well, I think they had 3 shots, but I don't know about the 4th one. Oh, we just cringe. We go, well, which one? Which one didn't you have? I don't know. So we'll try our best to get records, and if we can't, we just revaccinate. And most of the parents are okay with that. I don't want to play the odds and say, well, it sounds like that was this vaccine, so I'm not going to give that one. And it's a tough one. So I do have some parents of internationally adopted kids who do not want to repeat that. I just say, well, that's my recommendation. That's really the official recommendation from the AAP, American Academy of Pediatrics. But you're never wrong to revaccinate if you don't know. So giving an extra dose like this is not an issue. My youngest child is 4.5. He got 4. He got the 4 Hep Bs. I was well aware that he got the 4, and I knew my wife was negative, but I didn't fight it. They said, is it all right? That's so funny because I'm a pediatrician, so I'm in there and they're giving, the nurse is doing it. She knows me too. Giving the vaccines to him right after he's born, giving the vitamin K shot. Is it right to give the Hep B? I said, yeah, just treat me like I'm a normal person. So yeah, he got the birth dose, even though there's really not any infection risk from his parents. He's probably not going to go anywhere in the first 2 months, significantly where he's going to get that. But I'm still a believer in it, so I think it's a good idea.
I have a question.
Yeah.
All of our, any mom that I've seen, and I was actually talking to my doctor about this, they think just because they breastfeed that they don't need to give shots.
Yeah.
I've never seen a formula-feeding mom who also thinks that they shouldn't do the shots. Does that have any extra protection, anything enough to make a difference? Because those are, I breastfeed. I'm not saying that is not a good thing to do, but it just seems like that would not be nearly enough protection against anything.
I think breastfeeding is probably the best way to feed your baby. Not every mom can do that for various reasons, but you're going to get some immunity benefit from doing that for sure. Are you going to get the kind of immunity benefit that you get from a vaccine? You will not at all. The antibodies that are passed through the placenta will last for about 6 months. So you get some partial immunity to things, but not complete immunity to things. And you'll get some immunity to simple viruses and things that people pick up. Vomiting diarrhea viruses, sometimes breastfeeding kids, really, they don't tend to get those nearly as often. I think there's kind of this layer of antibody that's kind of lining the intestinal system from being breastfed, and that's like a wall that some viruses just can't get through. And that's great. So I really play up how great that is. But we don't know whether that's going to prevent anybody from getting an infection. We just don't have any proof that that's better or anywhere equal to giving a vaccine. So I think that's a mindset that you do see in some people. On breastfeeding my baby, wouldn't that be enough? And that kind of goes to what I said before of, isn't it better to just have natural immunity? Well, it is if the disease doesn't kill you. It's better to have natural immunity. So I would always advocate for breastfeeding, but not because then we can skip vaccines. I think that is an advocate to vaccines, but not a substitute for them.
Because we're running out of time, if we have families that say that they aren't going to vaccinate, we're not going to be able to convince them any different, what can we tell them that will allow their children, how do they go to school or preschool without vaccinations, and what are their rights to...
Well, that's a tough one. Here's what happens in the state of Michigan. You can claim religious exemption for any reason. You don't have to go to church. You don't have to have an affiliated religion. You just say religious exemption, and it's done. We're not real happy about that as pediatricians or public health officials. I have a form in my office. I have a couple things I was going to get out here to show you guys. A form in my office that's a refusal to vaccinate form, and I say, well, I've discussed all these things with you, and if you really feel like you don't want to go on and vaccinate your child, then I'd like you to sign this that says that I've discussed all of the possibilities that might happen with your child, and you accept responsibility for all those things, and then I put that in the chart. There are some cases where somebody would get something that they could have been vaccinated against and then blame the pediatrician that didn't vaccinate their child when they refused it in the first place. So this is kind of a statement of fact that says, you refused it on this date, and I've got it in my chart now. So it protects me a little bit, but also something where you can come back and say, remember when you signed this. So that's one thing you can do. The other thing that you can do is kind of try to keep educating them, and I have a number of things here that I think I'd given you something before, like from the Children's Hospital of Philadelphia. And these are all forms on the different vaccines, and there's one in there that kind of covers all of them. And I try and give these to them, and I really try and get into not just a blanket refusal, but I want you to tell me why. If you want me to be your pediatrician, you want to have a relationship with me where we're going to discuss your child's health, there has to be some sort of trust and some sort of discussion going on at every visit. If you don't trust me at all, am I the person for you or not? You know, and I do have some families like this. I'll see him at 2 weeks old, and I'll never see him again. And I had one that came in a month ago or so that I hadn't seen for 3 years. And I thought, well, I thought they'd moved on and gone to somebody else, but no. They just had taken care of their child at home. They didn't want anything to do with conventional medical anything. And there are families like that out there. So you're going to see some of that. But I think that there has to be, you know, like in adults' physician relationships, there has to be some trust there. So what I hear from those parents is, you don't trust me at all, but you still want to come. Then I think, well, how can you trust my advice on illnesses or colds, or whether you need to go to the ER tonight because of your asthma attack, or, you know, I mean, I have no personal say in advising anything that would be against the health of their child. Their health of their child is always the most important thing. So I try and work on that a little bit and say, I think that you need to come up with some things to discuss with me regarding this, rather than just a viewpoint of, I'm just not going to do it. So I could have the viewpoint and say, I'm just not going to take anybody in my office that has any vaccine questions, but that would be kind of crazy too. And there are some offices that will do that. If you're going to challenge me a lot, I'm going to send you out the door. I think a smarter way to do it is to say, let's talk about what your questions are. And if you kind of take away that alienation factor, and you take away the fact that most people are labeling them as a little crazy, and you say, well, I understand the concern, even though I think that your suspicions are ill-founded, you know, maybe we can discuss how this might work out better for you. And I do have some people that I had no idea that I could get them to do anything vaccine-wise. We'll turn around and do like 2 or 3 of them at a visit where they should have gotten 4 or 5. I walked out of a room a couple weeks ago, and one of my nurses said, I can't believe that mom is getting those vaccines. And I said, I can't really either. Like, you know, I just had the kinds of discussions that I'm having with you right now. But I think if you talk in a calm manner and you say, you know, I'm only looking at what's best for your child. This is not about me making money. It's not about the vaccine companies making money. It's not about us trying to tell you that you're wrong in everything that you do. It's about doing the right thing for your child, you know. And then really what you're saying, if you don't want to vaccinate, is I'm okay with getting this disease, that disease population is small enough that I'm probably not going to have an issue with that with my child. But I don't think we can say that. You know, having worked with sick kids in intensive care situations, I just don't think you can say that at all. A lot of what happens that's bad to people, many of us know this from any medical situation with any family member, just ask yourself, does bad luck come into play in most of those things? It does. Exposures to things, accidents, car accidents. You know, life is like one big accident waiting to happen. That's what I think. So if you're prepared, then it's not a catastrophic thing if you're exposed to something, and you don't know when your exposures occur. You know, one of the things that we really worry about in a terrorist kind of environment is biological warfare. You know, I think one of the biggest things that could do damage is not the traditional warfare, but biologic warfare. So what if there was a vaccine against a biologic warfare? You know, would everybody line up for that? I think that there's just too much thought that vaccines are dangerous and not enough thought of what they do that's good and what they prevent. So I try and get them to tell me exactly what their issues are, and then if I just can't get them to budge at all, I'll have them sign one of those forms. And even the moms that won't vaccinate certain things, I'll still have them sign one of those forms. And usually I run way behind because I talked to that mom a bunch and took a bunch of extra time. But I do think sometimes if they get the impression from you that you're going to take more time and answer their questions, they're more likely to see you as an advocate than as an enemy. So I have some colleagues in town that will kick people out of their office because they won't vaccinate. And I think, no, that just kind of perpetuates the viewpoint that it's us versus you. And I think if you have that viewpoint, then you've made them feel like they made the right choice. Yeah, that guy was just crazy anyway. Look what he did. He kicked me out of his office. Instead of saying, he kind of made some points there. It made me feel bad that I didn't want to do it. And that's the way that I come across. I think you're better to sell it in that way than to be absolute and say, well, I just think you should go. I've had a couple people come to the office where they'll say from the very beginning they want to have a get acquainted visit, absolutely no vaccines. Should I come here? And sometimes their answer to that is no. You know, if you think that you don't want to have a discussion, that's my statement to them. If you don't want to have any discussions about it ever, maybe not a good office for you. You know, we haven't even established a relationship yet. We don't need to establish a relationship if you think it's going to be really kind of contentious the whole time. But I'm not a fan of kicking them out. So that's the way I would approach it. I probably have a big percentage of the patients who get the full complement of vaccines that they are asked and recommended to get. I have a fair number that I'm working on. I call them kind of a work in progress. And I'll say, well, yeah, that mom's kind of starting to turn around and starting to understand. I've had a couple that really think their child's invulnerable if they are breastfed and they're eating organic foods and there aren't any things that will harm this child. And when they start coming in with all their ear infections, they'll say, yeah, well, I guess, this isn't working out quite the way I thought it was. So they really are susceptible to some illnesses. An ear infection is no big deal, but I think it's an illustration of you can do all the right things and it doesn't matter sometimes. They're still going to get something, so there's still going to be an exposure factor there. So that's the way I would approach it. But when you see a lot of situations with school entry, and it'll just say vaccines, and the parents will say, religious exemption, or they'll pull them out and homeschool them. And it's really easy to homeschool your child, too. It's the same thing. You just have to say religious exemption. That's what I want to do. I want to homeschool my kids. I'm kind of worried a little bit about the educational situation with some of the parents that are homeschooling. I don't think are quite prepared to homeschool. But we'll see what happens with that. So anything else anybody wants to ask about?
I just have one quick.
Okay, go ahead.
Totally off the subject, but I was talking to a mom about that.
And you weren't